Okay, so you're listening to a podcast called My Child is Deaf, Now What? My name is Christine Frazine. I am a second year audiology student going for my degree in the doctorate of audiology. I got my bachelor's degree in science, specifically speech, language, and hearing sciences. Currently, I'm doing some research on the effects that the COVID-19 pandemic have had on caregivers and their ability to, do their job and care for their loved ones. And I am with my friend and classmate Emily.
Hi, my name is Emily Corder, and I am a CMU alumni. I went to Central Michigan University for my bachelor's degree in communication sciences and disorders, and now I am attending Central Michigan University for my audiology doctorate degree. I am a second year audiology student, just like Christine. We are taking a pediatrics class, and we decided that this would be a great project in order to help parents out a little bit and feel more justified for their reactions and answer some questions about what happens when your child is diagnosed with a severe to profound hearing loss. What does that mean? How are they going to grow up? You have a lot of questions as parents, and we're really ready to answer those.
Yeah, so just kind of to get started here, more than likely, us as audiologists, have seen most of our babies or young children because they referred on a test called the Universal Newborn Hearing Screening. Now, in the whirlwind that happens after a mother gives birth, one of the things that the nurses will do is they'll test the baby's hearing. Um, and it is based on a pass or refer basis. So it's a quick kind of automated test that tests each ear individually. And if it's good to go, they pass and they can move on. If they refer in one ear or both, um, you know, then they kind of, I don't want to say flag the baby, but it's kind of raises a little bit of a red flag. But the hospital, at least this is how it works in Michigan, will then retest the baby before they leave. And if they pass both ears at that second test, they are good to go. But if they refer again in another ear or the same ear, then they will be referred to an audiologist for a full hearing evaluation. Now, if you're listening to this podcast, you've probably already been through this process, but to give you some information in case you're still curious about the tests that we as audiologists do, when you come to see us, if your baby is real young, they will do a test called an auditory brainstem response. Now, this is where they hook the baby up with these wires and electrodes that are just kind of like stickers. They don't hurt, and then they measure the electrical field around the baby's skull, and then they will play some tones into the baby's ears, and those electrodes are going to pick up a response, whether or not the baby heard the sound. Now, that is not to be confused with, you know, I don't want to say heard necessarily, because it's more of how their brainstem is responding to the sound reaching it. So we can tell you confidently after that test if sound is reaching the brainstem. However, we always like to see babies back for different audiometry, so different hearing tests, because that is really the gold standard, is what we call the behavioral testing. So this is where we might play some videos and have the baby listen to some speech and turn their head, or we might even have the child, if they're old enough, play some games with the audiologist. All of these tests and all these different things are a way to get a really well-rounded picture about how, not only how the child is hearing, but how they're using their hearing after they listen to a sound or a speech. And so that's kind of what leads into the diagnosis of a hearing loss. So this podcast is kind of designed in mind for parents who just found out that their baby or their young child has what we call either like a severe or a profound sensory neural hearing loss. Um, so, you know, we have this podcast in mind for that is the technical terms, I guess you could say, for deaf. We don't usually use deaf clinically as a word. It's more about the severity of their hearing loss. Deaf is more of I don't know how you would say it. It could be cultural. It could be, yeah, it could be an identity thing. So that being said, that kind of leads into our first question, I think, and I'll let Emily kind of take the lead on this next part. But one of the most common questions parents sort of ask as soon as we give the diagnosis is it permanent?
Yeah, is it permanent? Are you sure it's permanent? Those are questions that do get asked. And before I answer those questions, I just want you to know that at any time you might have emotions over these questions. You might have had emotions when you were sitting in the audiology office. This is a process, it's a journey that we're going through with you and with your child. And we're here to help support you along that journey. So none of these questions are meant to be judgmental. None of these questions are to make you feel like you're an awful parent because you're not. The fact that you followed up on your child's hearing screening and you went to a diagnostic appointment and you're here taking your free time doing research and you found this podcast and you're listening to it shows that you're going to be a great, amazing parent and a wonderful advocate for your child. But I want to get back to the questions because that's really what we're all here for. So, as Christine said earlier, the hearing loss type that we're talking about is a sensorineural hearing loss. And basically, what that means is that the inner ear has hair cells that help us send the signals that we hear. And those could be completely dead. There could be regions that are dead. Maybe they just are bent over and not working as well as they're supposed to. They could just be damaged. There's a variety of different ways that there could be a problem or the inner ear could be affected. But that type of hearing loss is permanent. We have no way at this point in time to treat it. We have, well, when I say treat it, I mean to cure it medically. That's not an option at this time. There are ways to treat the hearing loss, which we'll talk about later. But there's no medical way of solving this issue. And I know as parents, this can come as a shock. So a lot of times we answer this question, and the follow up is, are you sure?
And I think it's totally normal to kind of, second guess what we're doing. This person, this strange doctor came into the room, hooked your baby up with some weird stickers, played some tones, and then is telling you that they're deaf. But you've seen their head turn to loud sounds, and you've seen like them respond to you saying their name. How can it be that your child is deaf? And those are all completely reasonable things to question. And Emily said it really well when she talked about how regions of the inner ear might be dead or only bits and pieces might not be working. And that could be why your child might be responding to some sounds. Your child might have access to some sounds, especially doors slamming and those loud sounds, because those typically aren't necessarily affected by the hearing loss we're talking about. But to answer the question of are we sure, yes. We as audiologists use evidence-based practice, so we are backing everything we do with studies upon studies of research. And we also always cross-check. So we do a variety of tests when your child comes in. Yes, we're going to play those tones and see how they're responding at different levels, but we're also going to see how the eardrum is moving. We're also going to see how the hair cells are reacting to some tones. And so we kind of cross-check through a variety of outlets to really make sure we're set in our diagnosis. So that being said, an audiologist would never give that diagnosis if they weren't absolutely sure. Um, so, but I know that can be, tricky to hear. Like Emily said, there's no cure, unfortunately. So it is dealing with what hearing that child has. and choosing the best intervention that we can for that child moving forward.
So that leads us to another question that is commonly asked. The question is usually from the mother, but it can be from the father. But it's, did I do anything to cause this hearing loss? When I was pregnant, did I do something wrong? Before I let Christine take away more of this answer, too, I just want to stress that no one is judging you. If your child has a hearing loss, we know that there are many reasons that a child could have a hearing loss, and that you should give yourself a little bit of a break because, again, you are doing everything right now. You're not ignoring the problem. You're looking up ways to like fix the problem and solve what's going on. And it's not even a problem, it's just a journey, and you have to find your way along the journey.
Absolutely. So, to answer the question of did I cause this? No. I would just like to emphasize that 100 times over. No, no, no. So, there are, however, risk factors that we consider. So perhaps there was some drug abuse during the pregnancy. Perhaps there was some alcohol abuse during during the pregnancy. Those types of things put your baby at risk for hearing loss. But I can tell you that the majority of the time, and a very high majority of the time, hearing loss can be genetic. Hearing loss can have an unknown cause. And it is very rarely, so rarely, that the mother did something during the pregnancy to cause the hearing loss. Um, that one of the things that should be available to more people is some genetic testing. So you might be interested in some, genetic counseling and that kind of thing that can give you more information about your family, your DNA essentially, and what sort of things can be running in your family that might cause hearing loss. So that might be something that you're interested in as a family, is to figure out, maybe your you as the parent, your parent had hearing loss and their parent had hearing loss, or your sisters, and you're wondering why there seems to be a trend in the family, and they can give you more information about the genetics behind it. But in short, to kind of wrap up, no, you did not cause your baby's hearing loss.
So then a follow-up question to that is, now that you as a parent understand, what is the hearing loss, why it could possibly be a cause, why you might not know the cause, you're going to move on to thinking about your child's future. If your child is just a baby, will they be able to go to preschool? Will they be able to run around and play with friends? Can we do play dates? If they're in school already, say kindergarten or pre-kindergarten, can they be in a classroom, like a mainstream classroom? Can they be successful? A lot of these questions are going through your head, and you're not alone. One of the most common questions that we got is your child going to be quote unquote normal? Or is your child going to be dumb or delayed? And I'm going to let Christine answer a little bit of this before I jump back in again.
Right. So I can tell you with absolute confidence that your child will have a meaningful and fulfilling life. We have, in our program, it might be a little bit more common to see these individuals, but I know several professors, supervisors, and friends who have hearing loss and have moved on to get college degrees. They have gotten married. They have beautiful children now, and they're having wonderful lives that are very meaningful to them. And hearing loss was just a little hiccup that they had to get used to, but that nothing more.
I love the way Christine just described that. It is just a little hiccup. It happened, or maybe it's a big hiccup to start with. And then when you reflect on it later, you're like, you know what? We managed that just fine. Like we said earlier, and I really like to emphasize, this is a journey that you're going through, and everyone's journey is going to look a little different. So there could be a period of time where your child is a little bit behind. But then the goal of all of your interventionists, your speech pathologist, your audiologist, your school teacher, their job is to help your child catch up and be where they should be typically developing and be the best that they can be. And if your child doesn't face those same things, that's also okay. That's not awful. Either way, it's not awful. It's just very much so its own individual journey, but they're all going to be successful, bright, and beautiful children.
One of the main points we wanted to kind of catch on as we sort of come wrapping this up full circle, but um, you know, my child is deaf now, what, right? So there are several different options that you can take. You at this point, I imagine if you've found this podcast, you've done a Google deep dive, as they say, into information about hearing loss and what that means for your child. And a lot of the things you might have come across were American Sign Language, cochlear implants, hearing aids, and maybe even things called AAC devices, which are computers or tablets or even sheets of paper that help a child communicate. Um, and we just kind of wanted to jump right into that. So, the key here is that you bring your baby in quickly. We get that full hearing test as soon as possible and start intervention one way or the other. It is so important that no matter what you choose, you start the baby early so that they can have as much chance for success as possible. So, that being said, I'll kind of speak on behalf of hearing aids and cochlear implants, and then I'm going to let Emily take over on the other side of the spectrum. She's a little bit more versed in that area than I am, but if your child is severely or profoundly deaf, hearing aids might be a great option for sound awareness. So, some of the concerns you might have as a parent are safety related, and hearing aids can help give enough sound so that your child can hear things like sirens and fire alarms, those kind of safety things. And in addition to that, they might even be able to do some speech therapy to be able to speak with those hearing aids. Another option that has become more and more popular is cochlear implants. And this is a surgically implanted device. Like I said, I'm sure you've seen a little bit of it if you're here listening to this podcast. But I can tell you from the perspective of an audiology student and kind of speaking on behalf of audiologists that children who are implanted and implanted early with a cochlear implant do so well that they don't just catch up with their hearing peers, but they stay there and they stay on track with their hearing typically developing and hearing friends and peers throughout their school years and into their adulthood. That you won't see any significant delays, that they'll speak with their friends and family in school, and you might see very like limited difficulty overall. Um, but before I kind of take a back seat and let Emily talk about sign language and things, is that no one thing is going to be a perfect fit for everyone. And it is important to you as the parent to make the best educated decision that you can make for your family and to also listen in on how the kid is feeling throughout the whole process. So, yeah.
Yeah, I love what Christine just said. I like to think of your hearing loss options as a menu. You have multiple options. You can go with one. You could do two different ways. It really depends on your family. You could do multiple different ways. But it's a menu and you can pick and choose. And if something doesn't work, you can try again. It doesn't mean that anything is wrong with your kiddo. It just means that wasn't the right fit for you and your family. But now I'm going to talk a little bit more about signed languages. When people think of someone who's deaf, they typically relate it back to a sign language such as American Sign Language. There are also other languages, though. There is a Sign Exact English, which is a signed form of English. It's not its own actual language. There's also cued speech, which is where you pair speech with different symbols around the face to help your child know what sounds you're making and differentiate between the really tricky ones, such as the difference between b and p. So that's just, those are different options for this. I have done a lot of time and energy looking into American Sign Language and figuring out, how we as health professions and healthcare workers can make sign language more open and normal for people to come in to contact with. But I also want to go back to that menu idea. Like, those are just options. If you want like a personal story, my cousin's deaf. She has been since she was a baby, and she's now a college student. She's worn hearing aids her entire life, but she also uses American Sign Language very fluently. She prefers sign language now that she's old enough to make that decision for herself, but she has both options in order to communicate. And that was just her parents' way of giving her an option as she grew up. You don't have to do that. It's just an option, and I wanted to share that there are ways to combine these and make them be very effective.
Absolutely. And I think that kind of leads into a really good piece of advice is to either through your audiologist or through some sort of group that you can get a hold of, but talk to parents who have gone one way or the other and take their perspective on it. You know, people are going to feel maybe very passionately one way or the other. And I'm sure parents would be very open to express some of their regrets or things that they would have done differently if they had to do it over again. And take as much information in as possible and make the best choice for you and your family.
Yeah, I definitely think that's great. I think before we really wrap up here, it's just knowing that this journey that you and your child are going on is specifically and uniquely yours. It's not your audiologist's. They should not get a say in what is done. They may give recommendations, they might tell you what has been done in the past, but the decision isn't theirs. This is your family's hearing loss, it's your family's journey. And in the end, we know you want to do what's best for your kiddo. So, really, just focusing in on what is best for them and helping them is going to be the best bet for you. And don't let other people make those decisions, make them uniquely for your own family.
Okay, and as kind of a last point, I just want to let you know that you have several audiologists all over the United States and the world who are rooting for you, and reach out and ask questions. You can absolutely reach out to either Emily or myself with any questions that you have about anything about hearing aids, cochlear implants, hearing loss, sign language, and we'll at least always be able to point you in the direction of someone who can help. That being said, thanks for listening.